Good morning. Welcome. I'm glad to see all of you here this morning. This is our speeches for English oral communications. This is an informative speech. I'm going to tell you about hip fractures. The fifth leading cause of death in people over 65 is hip fractures. 2/3 of those deaths are due to falls. My father is 84 years old. He fell 3 weeks ago and broke his hip, and he is now in a hospice house. He had several comorbidities that have affected his stay. An article by WRAL saying 300,000 people a year suffer hip fractures in this country. The National Institute of Health says that worldwide, approximately 1.7 million people break a hip every year. And the cost of that, either directly or indirectly, is $131 billion a year. Through this speech, I'm going to tell you about the types of hip fractures, risk factors for hip fractures, and how to prevent hip fractures. According to the American Association of Orthopedic Surgeons, a hip can be broken in 3 places, and that's how they classify hip fractures. First, it can be the ball of the femur, which is the femoral head, which most people know as the ball of the hip joint. When this breaks off, it loses blood supply, and that ball will die. In order to fix that, they do what they call is a hemiarthroplasty, or a half of a hip joint. They don't have to replace the socket, just the ball. The second kind is an intratrochanteric fracture, which is the femoral neck. It's the narrow part between the head and the shaft of the femur. Those are the easiest to fix. They can usually be fixed by pinning, and hopefully the blood supply to the ball will not be interrupted, so therefore you don't lose blood supply. The third is a subtroch, which is actually breaking the femur on the top 2.5 inches of the femur. These fractures usually are people that have had total hips in the past, then fall, and the femur actually breaks around the prosthesis. Those are fixed by a side plate and pinning. Surgically, after surgery, you can see by this poster, this is your normal hip. This is one that has been fixed with the hemiarthroplasty. It has the whole piece in there. The middle one is an intratroch fracture, and it has been pinned. And this last one is a subtroch fracture, where it has the side plate with the pins going into the hip and then the screws into the femur. Risk factors after surgery, according to the Journal of Medicine, some of the complications that we worry about are pain control, delirium, blood clots, and pressure ulcers. And as you know, none of those are good. According to the American Association of Orthopedic Surgeons and the Mayo Clinic, some of the risk factors for hip fractures are age, sex, women more so than men, chronic medical conditions, nutritional problems, inactivity, tobacco use, and alcohol use. So the main thing that we can do as far as these risk factors, check with your pharmacy. Make sure you're not on any medications that are decreasing your bone supply and causes osteoporosis. Make sure you're eating enough. Make sure you're not on any drugs that might cause you to be unstable or dizzy. Some of the recommendations from the CDC and the National Institute of Health for prevention: have your vision checked regularly. Make sure your glasses are right. Take vitamin D and calcium. It's been proven that they help maintain bone. These both help with osteoporosis. OrthoInfo states that things that we can do within our home. Make sure we have good lighting. Put railings in your bathroom next to your commode or beside your shower to help get in and out. Put grippers in the shower so that you don't take a chance of falling, or use a shower chair. If you have throw rugs, get rid of them. You don't want to trip over them and fall. Get rid of clutter. Make sure there's good lighting. Do you have any of those risk factors at home? You know, this is something we need to go and look. Is your home safe? We need to be proactive. We don't want to be one of the 5 people that in the fifth. We don't want to be in that 5% of deaths after